This video only covers selected highlights of the RemunityPRO Pump User Guide and is not intended to replace the user guide. For complete details, including warnings and cautions related to the RemunityPRO Pump, refer to the user guide. For safety information related to Remodulin, please see the end of the video and the full prescribing information. In this video, we will cover different types of alerts and alarms. Refer to the user guide for a detailed list of alerts and alarms and step-by-step instructions. When the system requires attention, the remote and pump will generate an alert or alarm. Alerts flash yellow and alarms flash red on the remote screen. Alerts and alarms that have not been silenced within 5 minutes will escalate to the maximum volume on the remote and pump. The remote will also vibrate regardless of the remote audio setting. Alarms are higher priority than alerts. In the event an alert and alarm occur at the same time, the alarm will be displayed on the remote. When an alert or alarm is occurring, the title and details are displayed on the remote. All alarms and some alerts also display a blue information icon that can be tapped for more information. When an alert is occurring, the pump plays the alert sounds. During an alert, the infusion is still delivering, but the alert should be addressed as soon as possible. When an alarm is occurring, the pump plays the alarm sounds. Delivery is stopped, and the alarm should be addressed right away. Do not perform troubleshooting steps while the pump is connected to the infusion site, as this may lead to unintended delivery. When the system is used in a loud environment, keep the remote in a clothing pocket so that the vibration from a notification can be felt. When experiencing an alarm or alert, tap the bell icon on the remote to silence it. Always read the alert or alarm title and details, and follow the steps in the exact order listed in the user guide. When available, the blue information icon can be tapped for more information about an alert or an alarm. This chapter provides examples of some of the alerts you may encounter. When there are 2 hours of delivery remaining, the cassette low alert will sound. Tap the bell to silence the alert. Read the alert information displayed on the remote, then tap the check mark to dismiss the alert screen. Prepare to complete a cassette change within the next 2 hours. The pump and remote use Bluetooth to stay connected. If they have not been close enough for 10 hours, a no communication alert will appear. Move the remote closer to the pump to re-establish a connection. The pairing failed alert means that the pump and remote were unable to pair. Make sure the pump and remote are close, then follow the steps to pair a pump in the user guide. The pump idle alert means the pump has not been delivering medication for at least 15 minutes. Silence the alert. Read the alert information displayed on the remote, then dismiss the alert screen. If a cassette or battery change is in progress, continue with those steps. Otherwise, tap Main Menu on the remote and select Start Delivery from the menu options. Confirm the infusion set tubing is connected to the infusion site and start delivery. This chapter provides examples of some of the alarms you may encounter. The cassette empty alarm means the cassette needs to be replaced. Silence the alarm, then read the alarm information displayed on the remote. Disconnect from the infusion site, then follow the steps for completing a cassette change. The occlusion alarm means that medication is blocked from being delivered due to a kink or blockage in the infusion set tubing or infusion site. Silence the alarm. Read the instructions, then dismiss the alarm screen. Disconnect from the infusion site. Straighten the infusion set tubing and check for kinks. Then, follow the steps for attaching the current cassette to the pump. If the alarm occurs again, complete a cassette change with a new cassette and new infusion set. If you continue to receive occlusion alarms, contact the specialty pharmacy. For questions, please refer to the RemunityPRO Pump User Guide for step-by-step instructions, or contact the specialty pharmacy or your healthcare provider. RemunityPRO Pump for Remodulin Treprostinil Injection. Indication: the RemunityPRO Pump for Remodulin Treprostinil Injection is intended for continuous subcutaneous delivery of Remodulin Treprostinil Injection for use in patients ages 17 and older. Important safety information for RemunityPRO. Warnings and cautions. Do not use the system outside the conditions listed in the user guide. Retain the user guide for future reference. Refer to the user guide for all warnings and cautions. Failure to comply with the following warnings and cautions may result in harm. Limited to use with Remodulin. Only RemunityPRO cassettes may be used with the RemunityPRO Pump. RemunityPRO Pump is for use only with FDA-cleared infusion sets. Medtronic Quickset Infusion Set, MMT-392, MMT-393, Neria Guard, 704060-5229, 704060-5226. Medtronic Silhouette Infusion Set, MMT-373, and Smith's Medical Clio 90 Infusion Set, 21-7-230-24, 21-7-220-24. Do not use disposables from previously opened or damaged sterile packaging, damaged disposable components, or expired sterile components. If the pump or remote fail to work as detailed in the user guide, stop using the pump and remote and switch to the alternate pump and remote included with your system. Only use the supplied cables with your RemunityPRO system, as other cables could interfere with pump function. Disconnect the infusion set tubing from your infusion site before removing the cassette from the pump. Avoid exposure of your pump and cassette to temperatures below 41 degrees Fahrenheit, 5 degrees Celsius, or above 104 degrees Fahrenheit, 40 degrees Celsius. The pump may affect nearby electrical and electronic devices, including medical devices, cell phones, Bluetooth devices, RFID readers, Wi-Fi equipment, and strong magnetic fields, causing these devices to operate abnormally or to stop functioning. Keep the pump, remote, and battery charger at least 12 inches, 30 centimeters, away from electrical, medical, and wireless devices. Do not open, crush, heat above 140 degrees Fahrenheit, 60 degrees Celsius, or incinerate the pump battery or remote, as doing so can lead to fire, burns, and property damage. This system supports flow rates between 8 microliters per hour and 225 microliters per hour. If the required flow rate is outside this range, discuss with your specialty pharmacy or healthcare provider. Prescription information. Caution: federal law USA restricts this device to sale by or on the order of a licensed healthcare provider. Use of this device without the training and supervision of a healthcare provider may lead to errors that result in harm. See the RemunityPRO Pump for Remodulin Treprostinil Injection user guide for further detailed important safety information, including warnings, cautions, and instructions on how to properly use the system. For further information, please call United Therapeutics Corp. at 1-844-864-8437. The RemunityPRO Pump for Remodulin Treprostinil Injection is manufactured for United Therapeutics Corporation. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. Remodulin Treprostinil Injection. What is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver problems. Your Remodulin dose may need to be adjusted if you have liver problems, have low blood pressure or bleeding problems, are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure, symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilatation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-844-UNITHER, 1-844-864-8437.